You know, sometimes making small changes can have a really big impact. I'm Dr. Brad Revering with Cross Timbers Dental, and today I'm going to show you some cases from, gosh, a long time ago. I actually went back in my archives and pulled out some actual photographs. These were taken like 20 years ago, in the year 2000 or so. And what you're going to find is some of the things we were able to do back then, I mean, we're still doing now and even doing it better these days just because things have gotten better. But the point of today's video is to show how we can make some small changes, listen to what patients want to do, and by kind of going through their options, they can select what they want for themselves and make a big improvement to their overall smile. So let's take a look at some of those right now. So here's a guy, look at here. This is June 20th, year 2000, right? That's when they used to put timestamps on photographs. But this guy here, he had a class reunion coming up, and he didn't like how these front two teeth looked. He had some old crowns that probably looked fine many years ago. I'm going to guess these crowns were placed maybe back in the 80s. And they were fine, but as time has gone on, his gums have moved up, and now you can see that black line right here at the gum line. Back then, they used to make crowns with metal, with porcelain on the outside, and unfortunately with that, the trade-off was that you would get a black line. Well, it was great if you could tuck it underneath the gum line, but as time went on, if someone's gums moved, now you could see that black line. The good thing is today we don't use metal at all with our restorations, so there is no more black line. But what he wanted was to get this fixed fairly quickly. So we replaced his front two crowns, as you can see right here, but we also went and did his this tooth right here that was kind of hanging back. We told him it would be great, it would be ideal to move that tooth forward orthodontically, but he didn't have time for that, he didn't want to go through that, he just wanted something to be fixed quickly. So we put some porcelain on that tooth. So this is a great example of somebody who came in, we just did 3 teeth on him. I mean, there's other things that could have been done to make this more textbook perfect, but this is all that he really wanted. To accomplish his goal, this is what we did. And he left, he went to his class reunion, and everything went great. But let's go through a couple other cases, just kind of show some similar approaches that we take. Here's another one. 2 teeth right here, old resin veneers. These things take on stain. We replace those with porcelain veneer. Porcelain doesn't stain like composite resin did. And so this person got a smile that blended in very nicely. Just 2 teeth on this one. Another one, just the 2 teeth. In this case, it was the front 2 teeth. Actually, these front 2 weren't so bad, but they just didn't have that kind of look that the patient was wanting. They were a little bit too opaque. They looked kind of fake. And so we took off those 2 old crowns and we put on 2 new ones, all ceramic again, no metal, and they looked better. Now, we could look in fine detail, like look at this chip right there on that side tooth. It would have been nice to just fill that one in, but the patient didn't want that, so we left that one alone. How about this? How about some lower teeth? You know, as we get older, we talk, our lips kind of show more and more of our lower teeth. This person, again, didn't like how these old crowns looked, especially right down here at the gum line. So we took off those and extended all porcelain crowns and went all the way to the gum line, and looks much better. Another one, someone just had some patch-up work. They kept getting it patched over and over, and it's finally time to do the right fix. Now, I say the right fix. Ideally, yes, put this person into orthodontics, get the teeth straightened, and then put some veneers on. But again, they didn't want to go through that time or expense to do it, so instead they opted to compromise, and they got still a very nice result. We did actually 6 teeth, so it's all of these guys right here. All 6 of those were replaced with porcelain crowns. And take a look at this tooth. For example, this one is still crowded, still out of position. We couldn't fix that with porcelain because it would throw off the bite. The patient knew this going in, and they were completely fine with it. It still achieved the result that they were after. Here's one I'll show you a couple different slides of. They did want to do their front 6 teeth, kind of balance things out. And there's a close-up, and then here's the side. And actually, on this one, I want to point out that, you know, ideally, it would have been nice to get this tooth back here, this premolar, fixed as well, or at least make it more proportionate. Because as you go from these kind of big teeth to this small tooth, it kind of drops off. The smile doesn't look as good as it could have. But again, what would this involve? It would involve yet another veneer and possibly even gum surgery to raise up that gum in order to make it look better. Well, kind of weighing out that situation and what the person ultimately wanted, they opted not to do that. And so instead, they got this result, which again for them was a big leap forward. This is what they really wanted. And let's see another one, old restoration. The seal had broken. Some bacteria that turns black gets in behind it right there. Took that off, put another one on. Actually, I think we also fixed this tooth with some bonding right there. Simple little fix, big change for this person. Again, this was back in 1999, so the photograph isn't all that great. And this person just wanted to do the front 6 teeth. And actually on this one, if you look more closely, not only do the teeth look better, but the gums are healthier. Look how red, and like it looks like these teeth are, or these gums are just ready to bleed. They just don't look all that great. And now that we got everything cleaned up, put some new stuff on that you could clean much easier, and it's more biocompatible, now the gums are much healthier. So it's not just always looking at how we can make the teeth look better, it's how we can make the overall patient's mouth healthier. Again, same person from the side, from the other side, remember, red gums, no more red gums. And then lastly, we have this simple fix, old crown, new crown. It would have been great if they could have gotten this gum graft put in, if they could have went through orthodontics and rotate these two teeth around, whiten everything, but they just opted not to do all those things. They just wanted this one thing taken care of, something we knew we could do. I'm kind of showing them previous examples. They kind of know what the result would be. They can always go back later and do the orthodontics and do the gum surgery, but for right now, this is what this person wanted to do as their first step. So the point of all these videos, or the point of this video for all these pictures, is to show kind of what's possible. We can do small things or we can do bigger things, and it's going to have a very nice impact on what the patient's ultimate goal is. And we can custom tailor things to what people want. We just have to know what it is that they want. So anyways, I love sharing these cases with you guys. I have more in the future, and I'll see you guys in some more videos. All right, take care. Thanks.